Hi there. How are you today? Welcome to Austin ASMR Clinic. How are you doing? You doing all right? That's good. Why don't you go ahead and have a seat right here? How can I help you? Oh, okay. You're coming in to see one of our doctors? We have several. So why don't I go ahead and find you in our system and see what time was yours scheduled? 10:15? Okay. Let's go ahead and put you in here. Okay, can you go ahead and please give me your first and last name? And starting with your first name and then your last name. And can you spell that out afterwards for me, please? Thank you. Okay. Nice name. I like your name. It's very pretty. Okay, so I have you on our schedule here. Let me pull these papers out because we'll be filling those out in a moment. And let's see, let me put this down here for a moment. Can I get your date of birth? Why, I just forgot to get your date of birth. Thank you. Okay, so it looks like, it's looking like you have an appointment with, let's see here, with Dr. Leland Cozy. Yeah, I had to just look at my paperwork because I had to make sure that these two match here. Okay, Leland Cozy. And it seems that you're going to be having, okay, how this clinic works is that first you have your ASMR assessment, then you have a selection and a session, okay? So you have your assessment first, and then they select you for a certain group, and then you'll have your session, okay? Does that make sense? Okay. So you're with Dr. Leland Cozy because we have many doctors here. In fact, we have 8 doctors. So I'm pretty new here, so if I, forget a couple of things and I have to look at my notes that I've taken, I appreciate your patience with me. Thank you. Alrighty. Why don't we go ahead and get started with your paperwork? Let me get my pen right quick here. Or actually my pencil, because the doctors like for me to use my pencil in case we need to correct anything on here. Okay, so I'm going to go ahead and write your first and last name. May I have your phone number, please? And your date of birth? Okay. May I get your employer name and or business? And your address, please. Do you have a primary care physician? All right. And an emergency contact? Okay. And their telephone number? Thank you. Is that 512 area code? Okay. Thank you. Do you have a secondary emergency contact? Just that one? Okay. Can I get your medical history right quick, please? Or actually, first of all, I want to get your chief complaint. So, what is it that you're coming in for? I mean, like, oh, okay. Insomnia? Okay. Yeah, Dr. Cozy will be able to help you with that for sure. And your medical history? Like medications that you're taking right now? Okay. That's 14 milligrams, you say? Okay. Are you allergic to anything? Do you have any sensitivities? Like latex or anything like that? Okay. No. All right. Have you had any recent injuries? Okay, so none right now. Okay. Okay, how is your quality of sleep? 1, poor, 5 being excellent. 1, okay. How about your energy level? You're at a 1 as well? Oh, I'm so sorry to know that. Okay. Quality of nutrition. Do you eat well, or is there any? Okay, so you eat fairly well. I'll just put that. So what are your goals for this session? Like, what do you want to get out of this session? What's your primary goal? You would like to have your insomnia reduced, or let me see, have your insomnia reduced. Or gone. Okay. All right. I'll have that put there. Okay. And oh, you want to make a payment? This is a cash-only clinic, so to see the doctor is $19. Okay. Thank you. I'll put that here, and let me let Dr. Cozy know that you're here. Dr. Cozy? Hi there. Your patient is here. Yeah. You going to send him back? Okay. Yeah, your first patient's here. All right. I'll send him back now. Thank you. All right. Dr. Cozy will see if you can just step through those double doors right there, and his assistant will take you back to the room. Thanks. And thank you for choosing Austin ASMR Clinic. Hello, Austin ASMR Clinic. This is Kitty. How may I help you? Oh, you're looking to schedule an appointment with one of our doctors? All right. Okay. May I get your name, please? And can you please spell it out for me? First and last. Okay, you gave me your first name, now you're just your last name. Thank you. All right. May I get your date of birth, please? And your address? Is that a street? Holiday Street. Pflugerville, Texas. All right, and your zip code? 7806. Okay. Oh no, I'm sorry, 78706. All right. And who are you planning on seeing today? Because we have openings today. Did you want to come in today? I see here that you've seen Dr. Bailey before. All right. You want to see Dr. Bailey again? Do you want to schedule today? We have openings at 11 o'clock and 11:30, and then 3 o'clock in the afternoon. At 11:30? Okay. And what are you coming in for? For an assessment? Okay. So you'll be getting an assessment. Wait a minute. Now you've seen Dr. Bailey before. So you'll be coming in for a session. Is that what you mean? Okay. Okay, I thought so. Yeah. Our sessions usually last, about an hour. And they're just different sounds to help you relax. Yeah, it's basically like a sleep clinic, except they monitor you and just to see how you're doing, like not on that complete day, as you know, but just throughout your visits. Unlike a sleep clinic that, takes a monitor of you all night long and then gives you a diagnosis. Okay. And do you have any complaints right now, like with anything that you're going through, or like any notes you want me to add? Okay. You're still having insomnia? I'm sorry. Okay. Alrighty. So I put you in to see Dr. Chris Bailey at 11:30 today, okay? Alright, we'll see you then. Thank you for calling Austin ASMR Clinic. Hi there, welcome to Austin ASMR Clinic. How can I help you today? Oh yeah, I do, inbound phone calls or appointments, and as well as taking the patients. So, but I always put my, I let the girls in the back take the calls whenever I get a patient, in person. So, how can I help you today? You can have a seat right here. Yes. Okay, you're here to see one of our doctors, but you haven't made an appointment. Well, we do have an 11 o'clock, and you're right on time to see the doctor if you want me to get you scheduled in. Who are our doctors? Well, let's see. I'm still learning. I'm pretty new, so I have to look at my little notes here. We have Dr. Chris Bailey, and all of them do the same thing, okay? They do the ASMR assessment, selection, and then session itself. All right, they just assess you and to see where you need to go, and like some of them do different types of sessions, latex, or they talk in they do talking throughout, in which they whisper, and some of them read stories to help you sleep. So it just depends. And then once they do a selection, they go ahead and do the session itself. Okay, they put you in a category and then they do that. So our doctors are Dr. Chris Bailey, Dr. Dimitri Ellis, Dr. Leland Cozy, Dr. Anna Smith, and Dr. Miriam Young, Dr. Ahmed Saeed. Okay. Any one of them can see you at 11. Okay. You want to get Dr. Ahmed Saeed. All right. So, may I get your first and last name, please? Actually, I'm going to write this down first so that way I can add it. Because they like to have this paperwork and then I add it to the computer. Yeah, we're still old school. We haven't had the luxury yet of, scanning this and putting it into the computer yet. So I have my notes. They have their notes back there. I have my notes on the computer and then so forth. Okay, may I get your name, please? Okay. And your phone number? Is that a 512 area code? On your name, just to make sure, because the last name and your first name, I just want to make sure that it is, correct all the way. So can you please, repeat that? Spell that out for me? Thanks. See, I already spelled the first name. Okay. Okay. And may I have your date of birth, please? And may I get your employer? All right, and your address, please. (1404) North Lamar. Okay. And is that Austin? Okay, and the zip code? 53? Okay, thank you. And who is your primary care physician? Okay, you don't have one yet. Okay, that's fine. You just moved here to Austin. All right, that's fine. I guess that's why you're coming here for the first time, huh? All right. And may I get any emergency contacts? We have 2 spaces here if you wanted to add a secondary contact. Is that Sutherland? That last name? And may I have his phone number to write down? Okay. And that's a 512 area code? Oh no, it's a 404. Do you have a secondary, person here in Austin? Or in Pflugerville or in this vicinity that we can call? Oh, he lives here, but his number is still... This is your husband. Okay. I see. Okay. All right. And may I have your... what is your chief complaint that you're coming in here to see the doctor for? Okay. So, you're having insomnia plus headaches. Yeah, insomnia may do that to you, but we'll let the Dr. Saeed, take care of that and make sure. May I get your medical history, please? Medications first. You take any medications? Just one? Okay. All right. Any allergies or sensitivities? Yes? Latex? Okay, thank you for letting us know that. We appreciate that. Recent injuries? Or hospital visits? Oh, you broke your arm recently? Or was that last year? Okay. Has it healed pretty good? Because we might lay you down or place you in a position that might be uncomfortable for you, if that's so. Okay. So, no, you don't. You're fine. Okay. So it's healed and you are fine with different positions of rest. Okay. And how's your quality of sleep? One being poor, 5 being excellent. It's about a That's about a 3. Okay. That's good. Energy level? Oh, okay. About a 4. Quality of nutrition? Okay, you're very fit. I can tell you're fit, yeah. You eat well, so that's good. Okay, and what are your goals for this session? The doctor always likes to know what you want to gain from the sessions. Since you have slight insomnia, you want to be able to get to sleep better, get more sleep, a little more sleep, and just relax. Okay, so relaxation. So you're coming here for relaxation and better rest. All right. Well, Dr. Saeed can do that for you and help you with that for sure. Alrighty, and let's see here. All right. So, and you said no hospital visits? So you did go to the hospital when you broke your arm. That's right. Okay. Alrighty. So if you want to just, let me just let Dr. Saeed know that you're here, and we'll get you back. Because it's already 5 minutes till 11 o'clock. Dr. Saeed, I just wanted to let you know that we have a new patient at 11 o'clock for you. You want to go ahead and send her back now? Okay. Dr. Saeed will see you. If you want to just walk through those double doors, he'll see you. His assistant will be right there waiting for you. Okay. Thank you. And thank you for choosing Austin ASMR Clinic. All right. You have a good day too. Thank you. Phone number, date of birth, employer, address, primary care physician, emergency contact, chief complaint, medical history, medications, allergies, Recent injury. Quality of sleep. Energy level 4. Quality of nutrition. Perfect. Excellent. And your goals for this section. Relaxation and better rest. Sarah, can you take this back to Dr. Saeed? Thank you. That's for his new patient, 11 o'clock. Okay, thank you. Oh, hey there, Miriam. Hello, how are you doing? That's good to see you. There's some fresh coffee over at the bar area or the counter area. I made some fresh coffee. Okay. Oh, your name is Myra. That's right. Dr. Miriam is, let me see here. What was her? Dr. Miriam Young. I'm so sorry. I'm getting you and her confused, the names. Okay. Hey, can you please do me a favor? Thanks. Can you just tell Dr. Bailey that he has a cancellation? I just got a call a little earlier. So it's 4 o'clock is going to it's canceled. Can you just let him know that? Because he's in with a patient, and I know that you're his assistant. So thanks, I appreciate it. Yeah, there's nothing to do whenever there's no patients. I just look at my telephone or my cell phone. Oh, okay, I'm getting one right now. Thank you for calling ASMR, Austin ASMR Clinic. How can I help you? Okay, you have a cancellation? All right. May I get your name, first and last name, and can you spell that out for me, please? All right. Okay. All right. And it shows here that, oh, and you know what? Let me get your date of birth just to make sure. It's a pretty common name, so yeah. Yeah, okay. That is you. And it shows here that you're going to be seeing Dr. Anna Smith. All right. Can I put a reason for that? Oh, you're ride-belled. So, your ride is unable to bring you. Okay. So basically, ride-belled to show. Alrighty. That's fine. That's fine. The doctor doesn't mind. We'll just call. She actually has another patient that was supposed to come in, and we'll just call her and see if she wants to come in at that time instead. All right. Did you want to reschedule that? Okay. We have next week. For next week, um, Dr. Smith has a 5 o'clock. Yeah, she has a 5 o'clock on Wednesday. You want to do that? Okay. 5 o'clock Wednesday. All right, we have you down. So we'll see you, Dr. Smith will see you next week, Wednesday at 5 o'clock. All right, well, thank you for calling Austin ASMR Clinic. You have a nice day. Hey, Nikita, I'm going to go ahead and take my lunch. Is that okay? All right, thanks.